Thank you everyone for joining us. Thanks for listening to our banter beforehand. I didn't realize we were already started. Really grateful that you all are here on this Giving Tuesday. Thank you so much for joining us. If you don't know what Giving Tuesday is, it is a global day of generosity and an opportunity to support the nonprofits whose missions mean the most to you. And so we appreciate you spending your valuable time with Sepsis Alliance today. My name is Savannah Stark. I'm the VP of Development and Marketing with Sepsis Alliance, and all of the other presenters will introduce themselves as they take over their slides. And before we start, I was just going to go over a few housekeeping topics. Hannah, if you want to go to the next slide. And so while I do that, we would love if you took a moment to say hello in the chat and tell us how long you've been involved with Sepsis Alliance, and if there's any other piece of information you would like to share, please go ahead and do that. Your audio is automatically muted. If you have any questions during the presentation, please type them into the Q&A box on your webinar dashboard. We'll try to get through as many questions as possible at the end. And the presentation is being recorded and will be available in the coming days. And if you want to go to the next slide, thank you all for putting your comments in the chat. You can see our agenda here. So we'll do some welcome, founder story, a donor spotlight, impact overview, talk a little bit about our programs and our response to the sepsis challenge, really show you your support in action, give you different ways to get involved this Giving Tuesday, and looking ahead to 2026, seeing more about our priorities and hearing from you as well. So we definitely want this to be interactive. Again, feel free to use the chat and Q&A box as you see fit. And with that, I am excited to introduce our first speaker today, Dr. Steve Simpson, who is the chair of the Sepsis Alliance Board of Directors.
Hi, everyone. Thanks for being with us, and thanks for your participation with Sepsis Alliance. Um, we've been really busy for last year, and you're going to hear in detail, but I am going to take just a moment to sum up everywhere that Sepsis Alliance is and has been. As you know, our founding, the heart and soul of our organization is public awareness, and we have not given up on that, and we have reached new heights with that this year, again, as you will see. We always will do that. We will always be supportive of patients and families that have been touched and injured by sepsis. We will always continue with our education of professionals, nurses and physicians and others who have an interest in sepsis. We have spent a lot of time in public advocacy with both state legislatures, where we have helped some states to put sepsis regulations in place, and with federal legislators. And finally, something that's fairly new for us this year is that we have dedicated ourselves to the proposition that we are looking for a cure for sepsis, both its immediate short-term effects, how it kills people, how it maims people, and its long-term effects, how it keeps people impaired sometimes for a lifetime. And that's what we are about. I'm pretty certain that's what you are about, and that's why you are part of our care holders. And I'm very appreciative that you're here today, as is everyone else on the phone call. So sit back and listen. There are a lot of good things that you're about to hear about where Sepsis Alliance has been and where Sepsis Alliance is going.
Good afternoon. I'm Carl Flatley. I'm actually the founder of Sepsis Alliance, and I want to say something about Steve and our personnel. Steve is one of 6 physicians that we have on board and many nurses. It's really in a board. It's like the who's who of sepsis. I mean, there is no sepsis specialty, but all these doctors and nurses are sepsis centric. I've learned so much from him. I'm not a physician. I was a dentist. I didn't know anything about sepsis until I lost my daughter, Erin, at age 23, who went in for a simple hemorrhoidectomy. I know it was 23 years ago, but and I've had people say, "Well, you must be feeling better now." Well, you don't get better. And I started this organization out of frustration, and because there was no organization. I went to CDC, NIH, I went to Congress, I hired a lobbyist, I went to the governor of Florida. Nothing was done. But this little organization started off. I had one sponsor, Eli Lilly, and we started off and we started gathering people. And much like Jim O'Brien, who Steve knows, he was the first physician that called me and said, "I'd like to help out." And I said, "Why are you calling? I mean, why would a physician want to help me start this thing?" He said, "I get tired of telling people every day that they just lost a loved one to something they've never heard of." And that's kind of where we started from. So this little organization started out, it is now worldwide. We're in all 50 states, but our organization plus four others started the Global Sepsis Alliance, which now has over 100 organizations. So it still amazes me that this little organization started the entire world change. And sepsis is the number one cause of death in most hospitals. So we're appreciative of you because you helped us get there. We can't do it without the funding, and that's made a big difference. You'll see here that our mission is to save lives. If you go back here, save lives, reduce suffering by educating the public. And that's how I started out. I didn't know anything about the rest. And it wasn't until Tom uh, Heyman came on board, our CEO, in 2007 that we started to get into all things sepsis. So it's not only knowing about sepsis, it's these intelligent doctors that do this every day that help us craft what we're doing here. We When it started, it was actually started as a website. It was called rememberaaron.com. I was going through a trial because my daughter should not have died. They didn't give her antibiotics in time, and she didn't make it. And so we spent 3 years in trial, and I started with rememberaaron.com. Then it became the American Sepsis Alliance because I could see this thing was getting bigger. And then when Tom Heyman came on board, it was global. We realized that, so we changed to the Sepsis Alliance. So that's the beginning of this little organization. Uh, we started out again; it was just awareness, but now antibiotic awareness, legislation, advocacy, and Tom will touch on those things. I want to thank the leadership of our organization because that's really where it's been. If you go to the next slide. Next slide, yes, thank you. So I want to thank everyone. All these names are people who have given to the Sepsis Alliance, and it's made such a difference. When I started out, it was very difficult to raise any kind of money because, and that's what we run on, is because no one had ever heard the word. So I've now spent 22 years. I'm on the back nine of life. I'm at a point where, I've got to look at a legacy. It's not something everyone does, but 50 years ago, I met a doctor who said that you have an ethical responsibility to be financially successful. Whatever you do, be financially successful. It's good for you. It's good for your wife. It's good for your patients or clients. And once you have enough money and you have enough for both the life expenses of you and your wife, then you have a moral obligation to be financially significant. And that's what I've done. I started the Founders Legacy Society to allow other people, because I'm not going to be around, to become a founder and other ways of giving. And I'll turn it over to Savannah because it's planned giving and it's something you might want to consider. And some people will give like 1 or 2% of their estate, and it makes such a difference. So I really want to thank everyone for helping us out. Savannah, if you wouldn't mind, please.
Yeah, absolutely. So this slide, we just wanted to take a minute to thank all of our generous donors who are part of either the Founders Legacy Society, which recognizes those donors who have named Sepsis Alliance as a beneficiary of their estate. And we also have our featured donors. We have two other giving societies, our Circle of Friends, which recognizes monthly donors, and Carl's Champions, which recognizes those individuals who give 1,000 or more per year. And so you'll see that list here. Thank you all. Some of you are on the call. We really appreciate your support. And if you have any questions about joining any of these giving societies, please reach out to us after this webinar, and we'll put our contact info in the chat. And you can go on to the next slide.
So I think
Tom, I think
this,
you're taking it from here.
I think it's me. Yep. Hello, everybody. I'm Tom Heyman, President and CEO of Sepsis Alliance. Thank you all for being here today. And we're going to start with numbers, but we know this is about real people. This is the U.S. alone, 1.7 million cases. That's 1.7 million families that are impacted by this every single year. And we know it's number one cause of death in hospitals, number one cause of hospital readmissions, and it's the most expensive cost of hospital care in the country. There was just some research that came out from IMHE, which is a global research organization in Seattle, and they learned that in 2021, 31.5% of all deaths in the world were related to sepsis. 31 so nearly 1 in 3. Now that was during COVID, so COVID, pushed those numbers higher. But normally it's about 20%, and it rose to 31.5%. So that's over 21 million people lost in a year due to sepsis. So really just this is something that has huge impact, and too little has been done in the fight against it. Next slide. So what are we doing? What's our response as an organization? We've structured ourselves in 4 strategic pillars. The first is public awareness, education, and support. And really our theory of change when I met Carl and realized he had not heard of sepsis, I had not heard of sepsis when I met him, that we're not going to get people to fight against something they've never heard of before. That's not going to work. So our theory of change was a rising tide lifts all boats. And if we can get that 19% awareness, which was what it was, up to 70s, 80s, 90s, there will be a response, and it will be a response accordant with the impact. So we've been very, very focused in that area, and you'll hear more about our efforts to raise public awareness, educate the public, and also support sepsis patients and survivors and family members. The other area is healthcare professional education and training. And, we didn't intend to get into this area. We thought healthcare professionals were being trained on sepsis. But no, we learned that's not the case. It was not the case then. And we did surveys and found out that many of our nurses, many of our first responders, many of our healthcare professionals across the continuum of care, it wasn't on their radar. They hadn't been trained in nursing school or medical school. They heard of it, but it really wasn't something they thought they were going to encounter. So that was problem number 2. And what we've done in response to that is really mount a massive effort to make sure that every healthcare professional in our country knows as much about sepsis as they know about stroke. So that's our mission. You'll hear more about the work we're doing in that area in a minute. Policy and advocacy. We have to make our legislators aware of this. This is the number one cost of hospital care in the country. It's killing 350,000 people every year, 7,000 children. Our policymakers are not aware of this, and as a result, they're not doing as much as we need them to do at the state and federal level. We'll talk a little bit more about what we're doing to make that happen. And then research and innovation. There's so much we don't know about sepsis. It's like the early days of cancer when I was a kid, cancer was one thing. And, I said, well, once we cure cancer, that'll be done. Well, cancer is more than 400 different types of cancer. And we believe there's a similar heterogeneity to sepsis that we need to better understand if we're really going to be able to diagnose and treat it more effectively than we are today. A lot we can do in the meantime, but we really need a deeper understanding of this condition. And so we're gonna be working on that, and we'll talk more about that in a minute. Next slide. And I turn it over to Megan.
Thanks, Tom. Hi, everyone. I'm Megan Jones. I'm the Director of Community Education and Support here at Sepsis Alliance. And I have the honor, I guess, of going first and talking a little bit more detail about some of our work this year. When we talk about Pillar 1, we're talking, as Tom described, about public awareness, education, and support, which means this is everything that touches anybody who has been personally impacted by sepsis or may one day be. So we're providing tools and resources to increase sepsis knowledge and support resources for patients, survivors, caregivers, and loved ones as well. Some highlights from the education and awareness side. We have now published more than 2,200 faces of sepsis experiences. If you're not familiar, this is a library of stories, both of folks who have had sepsis and survived, and also tribute stories to folks who have unfortunately been lost to sepsis, that are a resource for folks who are maybe newly navigating this journey to want to know a little bit more about what others have experienced, to know that they're not alone. We also have a sepsis and library on our sepsis.org website, which features resources on 79 different topics now related to sepsis. This is anything from intersecting conditions like diabetes to stages of life or professions or things like that, anything that sort of has a topical intersection with sepsis. We also carried out a vaccine confidence campaign in certain medically underserved areas, which you can still find at getvaxxed.org. We thought this was really important work this year because we know that infection prevention is sepsis prevention, and one of the most important things we can all do to prevent or help prevent infections is to get vaccinated when we qualify for those vaccines. And then finally, we also completed a program to equip sepsis survivors and caregivers to contribute as patient partners in the design, conduct, and dissemination of research studies. I could share about this for a whole lot longer than I have today because it was a project that was really exciting to me. But basically, we believe that patients are valuable in research studies, not just as subjects of research, but also contributing to how those research studies work. And so making sure that we are supporting the research community with patients and loved ones who are really equipped, who understand the process and are able to bring their lived experience to those projects. And then on the Sepsis Alliance Connect side, this is a piece of our work that's really close to my heart, and the ability to, work every day with folks who have been personally impacted by sepsis, especially a bunch of our volunteers. We reached more than 5,500 members this year, and that's an 83% increase over this time last year. So that community is just growing exponentially. And it's something that I know many of you are already members of, but if you are not a member and you are someone who has been personally touched by sepsis, which I suspect many of you have, if you're invested enough to be here with us on a Tuesday afternoon, I really encourage you to visit sepsisconnect.org and register so that you can be a part of that community. Next slide, please. And then one more slide for me. This is just a snapshot of what your support of Sepsis Alliance is really making possible in the Pillar 1, the public awareness side. So many awareness tables, educational campaigns, and just opportunities to bring both Sepsis Alliance's message, but also your voices out into the community. You have the power to reach people that I do not, and so we really value both your support of Sepsis Alliance financially, but also your story, your hands, your feet, your ability to get out in the community and spread that word. I think that's it from me. So we can go to the next slide and pass it to Claudia.
Thank you, Megan. Hi, everyone. Some of you know me, but for those that may not, I'm Claudia Orth, the Director of Professional Education and Training. I'm incredibly fortunate to lead an incredible team that supports our Pillar 2 Healthcare Professional Education and Training Program and Sepsis Alliance Institute. I'm also a critical care nurse and former sepsis coordinator who for many, many years prior to joining Sepsis Alliance benefited from the plethora of free educational programs, tools, and resources we provide for both the public survivors and, of course, healthcare professionals. Through Sepsis Alliance Institute, which now has over 69,000 healthcare professional members from across the U.S. and even the globe, we provide education via both live, virtual webinars, symposia, and conferences, as well as over 200. We also have over 200 on-demand continuing education courses. In addition to that, we are accredited by the California Board of Nursing to offer CNE, and we now are also newly accredited to offer CME. Furthermore, Sepsis Alliance Institute services our healthcare professional community dedicated to peer-to-peer networking. The community serves as a safe forum to ask questions and access and share tools and resources. Additionally, we launched our first ever podcast series called The Sepsis Spectrum this year. Sepsis 1 focused on microbial mysteries, and Season 2 focused on multi-system organ dysfunction syndrome, or MODS, is currently underway with new episodes being released every Tuesday. The podcast can be found on YouTube and all major streaming services. For more information, feel free to check out sepsisinstitute.org or for the podcast specifically, sepsispodcast.org. Next slide. Sepsis Alliance Institute and all our Pillar 2 work relies on funding support, which allows us to run the Sepsis Alliance Institute's community and learning management system, where we continue developing high-quality, timely education, tools, and resources on all things sepsis, infection, prevention, HAI, and AMR. Michelle Evans, pictured here, is this in the Sepsis Superheroes cape on the right, was able to utilize our free Sepsis Alliance resources during Sepsis Awareness Month and throughout the year to increase her organization's SEP1 compliance and reduce mortality. Every day, members of our Sepsis Alliance Institute community, just like Michelle and some of you on the line, I saw some familiar faces, are using the community to connect, share resources, and get timely questions answered. With funding support, we have also been able to recruit some of the foremost sepsis experts in the country to provide evidence-based CNE and CME talks and to join us as our guests on the Sepsis Spectrum podcast. Some hospitals have utilized our TIME acronym to help them streamline their sepsis screening. Others are using the newly developed 5-module Sepsis Alliance Presents Sepsis Fundamentals course to train their staff as part of onboarding or to become sepsis unit champions. Every little bit helps, and without the support from folks like yourself and others, we would not be able to continue to do this work to save lives and limbs from sepsis and support healthcare professionals around the country doing the hard work in the trenches and on the front lines. So thank you for all that you're doing and for being here today. I always say sepsis is a team sport and it takes a village. Thank you. Next slide.
Thanks, Claudia. That's great. So Pillar 3, policy and advocacy, this is where we really leverage, all the work we do in Pillars 1 and 2 to engage with patients and family members, to engage with our healthcare professional community, and bring our message as a collective to our policymakers, and so that we're getting our fair share. We know that NIH, National Institute of Health spending on sepsis, is pennies on the dollar compared to other conditions, and we're not getting the regulatory support that we deserve given the size of the impact of sepsis. So our job is to make sure we get our fair share and that we're heard, for the size of the problem. So we formed Sepsis Alliance Voices, which is our program to leverage our patient and healthcare professional and partner voices into influencing regulatory policy and legislation. And we've had a lot of success. The SEP1 hospital measure for sepsis is something that we fought hard for reauthorization, requiring hospitals to have a sepsis bundle in place. So when they suspect sepsis, there are certain things that they must do. And based on our advocacy, that measure is now part of value-based purchasing. So hospitals not only will have to report on how well they do on this measure, but they will be reimbursed depending on how well they do it. And you can be sure that interest and attention has grown as a result of that. Additionally, we worked hand in hand with partners to get a new ICD-10 diagnosis code for post-hospital sepsis care. So until about a year ago, there was no way for a clinician to diagnose someone who had been in the hospital for sepsis. So now there is a way to record that, reimburse for it, and really an important step forward for sepsis survivors to get the care they need. Lachlan's Law. This is in the state of Maryland. Lachlan, just tragically, a 5-year-old whose parents took him to their local urgent care, as we do, and he wasn't feeling well at all. And the folks at urgent care, doing the best, diagnosed it as just the flu, quote unquote, and sent them home, said, keep him hydrated and he'll be fine. And Lachlan died 12 hours later in hospital. Just jaw dropping. And, the family decided they wanted to do something about this and, make sure this didn't happen to other families in the future. So we worked hand in hand with the family, and Lachlan's Law was signed by Governor Moore last year, and it requires hospitals in Maryland and urgent care centers to have a sepsis treatment bundle in place, and training and education for all staff who are treating patients. So a real game changer. There's nothing like this had ever been done before in the country. Lulu's Law is something we're working on. Lulu's Law would call for two things. One, a national sepsis action plan. Many countries have them. We do not yet. And it also calls for the development of a national sepsis data trust, kind of like the cancer registry, which has allowed us to really better understand cancer and its many types. we want to do something like that for sepsis. So those are the two elements of that. Next slide. So here's just some of the pictures of us at work. In the bottom right, you'll see us. We were brought a group of board members and staff and advocates from around the country to Capitol Hill, and we had dozens of meetings with elected officials. Again, impacting upon them that this is something that's very important. Your constituents care about it. It costs a lot of money, and it takes a lot of lives, and it really impairs a lot of folks who survive and keeps them out of work for extended periods of time. On the upper left picture is part of that Hill Day. We held a panel over a luncheon and had great speakers there. And in the upper right is me and Cindy Ho, our Chief Medical Officer, and Lucas Haynes from our board, and Henry Zhu, who works with us as an advocacy consultant. And we are working hard to advance the Stop Sepsis Act, which will require hospitals in New Jersey to have protocols in place and also report to the Department of Health so we can track who's doing well, who's not, and maybe how we can improve the care in those hospitals that are lagging. We had a unanimous yes vote in the Senate Health Committee, which was great. There was not a dry eye in the place, and now our next step is take it to the State Assembly Health Committee, which happens on December 11th. So we're hard at work in New Jersey, and we want to make sure that every state and the entire country has sepsis screening tools and protocols and training in place. Next slide. So turning to pillar 4, research and innovation. So this is where we really kind of lean into how can we as a patient advocacy organization help accelerate innovation from brain to bedside so that these great ideas that they don't get stuck in the lab, they don't get stuck in the regulatory process, they don't get stuck without a reimbursement opportunity so hospitals can actually use them. So we're working very, very hard with our industry partners and our government partners to see what we can do to help move the ball here. So we do research in cooperation with many of our industry partners. We work with government agencies to conduct research and really, impress upon them what's important and why sepsis is important and what they can do to be a more helpful partner. This all came together this past September with our first in-person symposium, the Unite for Sepsis Symposium, which brought together almost 200 of the leading minds in the field, research, innovation, healthcare practice, government, investors, to really come together and talk about what do we know about sepsis, what don't we know, how can we get from here to there, and develop action plans to make sure that we're moving forward. Very successful event, and as a result of that, we're moving the event to Washington, D.C., to a bigger venue and to be closer to our national policymakers. And we moved the date up, and it'll be June 11th and 12th. So really excited and looking forward to that. Next slide. And is this me still? Let's see.
Yep. You just talked
Still
about
me.
it a bit. Yep.
Still me. I stole my own thunder a little bit here. But yeah, so, it's been a really, really impactful full year. The Unite for Sepsis Symposium and many other things. And next slide. So here's some what we accomplished. Awareness has gone up to 75% in the US. That means we've gone from 19% to 75%, which is 150 million people in this country who have gone from being completely unaware of sepsis to having awareness of sepsis. That's a huge, huge piece of progress. We've trained 65,000, closer to 70,000 healthcare professionals so that they'll be better equipped to know when they're looking at sepsis and they can provide better care. So when you or I call 911, walk into an urgent care, walk into a hospital, have a home health aide, whatever it might be, that we're going to be more likely to be properly diagnosed and treated. And Megan mentioned we have over 5,500 members in our patient support community, and that's growing at about 200 a month now as word gets out about how powerful an opportunity this is for people to feel part of a community. And then, in Pillar 2, we've now, with ACCME, we can offer medical education to nurses and medical education credits to physicians and lots of other caregivers. And we've awarded over 170,000 continuing education credits. Next slide. And I think we're over to Alex now.
Yes. Hi, I'm Alex. I'm our VP of Marketing and Communications for those who haven't met me. And I want to make everyone aware of our most recent sepsis awareness survey. This is an annual survey we do to measure how many people, adults in the US, are aware of the term sepsis. And we had a record high 75% this year. We were at 69% last year. This is a huge jump, and we're so excited to have more people aware of the term sepsis, although it definitely doesn't mean that we don't have any more work to do. There's still a lot of work to do, and there's a lot of awareness to be raised about the signs and symptoms as well. So we'll continue doing this work. We've included a QR code here to access the full survey. You can also go to sepsis.org and search it in our news section to find the whole report and see what else we measured this year. Next slide, please. And if you are following us on social media, you have hopefully seen that we have a partnership right now with Ronnie Coleman. He's an 8-time Mr. Olympia, as well as a sepsis survivor. Earlier this year, his 13-year-old daughter actually noticed he was unwell, called 911, and he ended up in the hospital with sepsis, and he is working very hard to help us raise awareness now. And I think we're going to play this video.
Ronnie, you're a living legend, an 8-time Mr. Olympia, the most decorated bodybuilder in bodybuilding history, and the fans simply love you.
I love y'all, and I could have never done it without y'all.
For years, Ronnie Coleman gave us strength. 8-time Mr. Olympia.
I am not lying, y'all the best fans in the whole wide world.
The king of bodybuilding. The man who never backed down. But even the strongest face battles. After countless surgeries, Ronnie is fighting once again. But now the fight is critical. It's a fight for his very life. Now it's our turn to lift him up, to stand with the man who inspired millions. We are all Ronnie Strong.
So you can watch that whole video on our YouTube channel. If you search Sepsis Alliance on YouTube, and after I'm done speaking, I will also put the link to our YouTube channel in the chat. But yeah, we're really excited to be working with Ronnie. We're hoping to do a lot more with him as well. He's really dedicated to helping raise sepsis awareness. It was not something he was familiar with, and it has changed his whole life now. So we are so grateful to him and to other celebrities who use their public voice to help us raise awareness. Next slide, please. And then I think we're back over to Tom.
Yes, indeed. Thanks, everybody. Wow. We did a lot last year, and we want to do even more next year. And thank you for all of you for your support. We could not do it without you. And just some of the things we're looking forward to next year is it'll be our 15th anniversary of Sepsis Awareness Month. So Alex and the gang are cooking up some really exciting plans around that to make it a year-long celebration of our 15th year of Sepsis Awareness Month. Sepsis Alliance Institute, we will continue to grow, particularly now that we have ACCME accreditation and can offer credits to all kinds of healthcare practitioners beyond nursing. That's going to be a tremendous opportunity for us. We have many new conferences and symposia coming up, including one on antimicrobial diagnostic stewardship and many other topics. We'll be redesigning our website. Not listed here, but very, very excited about that. It's been a number of years, and I think that's going to be a great opportunity for us. And we'll have our conference in Washington, D.C., of course, and continuing to work at the state and federal level to advance policy and regulatory issues that can really help accelerate our response to sepsis. So really excited about this and look forward to sharing this with you and working with all of you on this as we move into the next year. And with that, I'm going to turn it over to our board member and friend, Katie Granger.
Hello, everybody. Can you see me now? Can you hear me?
Yep.
Okay, sorry about that delay. I just wanted to mention the importance of Giving Tuesday. As a sepsis survivor and a board member of Sepsis Alliance, I've had the opportunity to spend 6 years with this organization, growing my own really my recovery has taken place here. And in doing it, I've become a patient advocate and a speaker and done a lot of things with Sepsis Alliance that we're talking about today. We want to expand these programs to include new voices and new people. And so I love the comments that are going on online. In fact, that's where I was messing around just now with everybody that's interested in sharing their stories. It's so important. The patient voice is one of the most amazing things that we have. And when I say patient, I also mean the families, the people that were there with them and the caregivers and the people who support them and who were impacted by sepsis beyond just the survivors and the people who have lost loved ones. So anyways, I just encourage all of you to understand that you have opportunities to give of yourself, but then also on this Giving Tuesday to give financially. It's really important that we support the organizations that we believe in. And I believe so strongly in Sepsis Alliance. I'm writing multiple checks today and going online and giving to multiple organizations, but we all hope that you will make Sepsis Alliance and keep Sepsis Alliance as one of your core organizations. Keep in mind that there is less public funding out there now, and so we need it more than ever. And I just know that your dollars, you've seen where they're going. You've seen the amazing staff that we have. I am so grateful. That's why they've asked me to talk. I'm just so grateful. I just gush all the time about how happy I am to be a part of this organization. And I've been given opportunities here, but more importantly, we have all these incredible people that work in the organization to get information out in all of our 4 pillars and to keep us growing. So we're making a big difference. To see the numbers of awareness is really incredible to see how those numbers have improved. And even in my tenure here of just 6 years, I've seen those numbers go up pretty significantly. So we're making a difference. We're getting out in the world. And I haven't mentioned this, but I am a multiple amputee. I'm missing 7 fingertips and both of my lower legs. More and more people like me are surviving. And I was the sickest of the sick, as many of you may have been here or your family members. And I know people have also lost family members. We want to see those numbers change, and we are making a difference. We are making an impact. We're seeing more people like myself survive they are able to make that choice to keep us alive. We may not have our limbs, but I have incredible prosthetic legs, and we are making advances in that area. But over time, we're going to see more people living, less people having lifelong complications. But we want to start with getting more of us surviving sepsis. And I know for a fact that had I gotten sepsis, say even 15 years ago, it was 7 years for me, I likely wouldn't have survived. And many of us that got as sick as I did wouldn't have survived even 15 years ago. So we are making strides. Carl, I can never say enough about you. The fact that you founded this organization, Tom came on, we have an incredible staff. I just can't say enough. So your dollar's going to a wonderful place. Thank you so much for all that you do to give to Sepsis Alliance.
Thank you so much, Katie. And Katie also led the charge. And I don't know, Katie, if you were going to bring this up, but the board is matching donations today. Yes, up to $15,000. So we are so appreciative to Katie and the rest of our board for coming together, really understanding the need to fundraise right now. And so, yeah, there's a match up to $15,000 for any donations made today. You can scan here to donate. And if we go to the next slide, I think we have a couple of other ways that you can support Sepsis Alliance this Giving Tuesday. Because we definitely understand not everyone is in a place to be able to give financially. And so there are plenty of ways to get involved and engage and help us. So engaging with us on social media, every time you like or share or comment on one of our posts, it helps to increase our reach. In terms of giving, you can make a one-time or monthly gift at sepsis.org. We also do accept gifts of stock, gifts through donor-advised funds, and if you're of age, an IRA rollover. Carl mentioned our Founders Legacy Society earlier. So if you want to think of Sepsis Alliance and everyone needs a plan, really help your families out. And if you'd like to name Sepsis Alliance as a beneficiary, we would really appreciate that. If you have any questions about ways to give, or if you'd like to plan a small fundraiser or event, you can contact Hannah at ageofstrosky@sepsis.org. We'll put that in the chat as well. And again, if you have any questions about how to give, how to get involved, feel free to use the Q&A box right now, and or contact us at any time by email. Okay, so we are ready to move on to the Q&A. I see some coming in. Before I read those, we thought it might be fun to have you all chime in and just share a little bit about what inspired you most today, about how, we as a group are making a difference in the lives of people impacted by sepsis. So would love to see your comments in the chat and again, questions through Q&A. So we have a question. How can we push to get laws like Lachlan's Law in our own states? Tom, do you want to take that?
I sure can. Yeah, it's a lot of these come from advocates in the state and originate with someone who has the connections and the passion in that state. In the case of Maryland, it was the DeSantis family who reached out to us and we provided technical support. I testified a couple of times in Annapolis and we provided kind of factual information and resources and things like that. So if you have an interest in that, you can get in touch with us at Sepsis Alliance Voices, and we'll put that contact information in the chat. You can also reach out to me directly at theyman@sepsis.org. And we are interested in doing this. It's been very hard to make things happen at the federal level, as I'm sure most of you know. So I think we see real opportunities at the state level to improve care and establish best practices. So definitely very interested in speaking with you and others who may have an interest in getting involved and working on an effort in your state.
Thanks, Tom. Megan, for you, someone said, I'm not comfortable sharing my story yet. Can I still join Sepsis Alliance Connect and get involved in that?
Thanks so much, Savannah, and thank you to whoever submitted this question. My answer to that is absolutely. I think one of the things I appreciate most about Sepsis Alliance Connect is that there are so many different ways to engage with the community depending on what makes you most comfortable. So yes, we do have sort of live Zoom style support conversations for folks that are wanting that and are feeling ready for that. But we also really encourage folks to engage with the discussion boards, whether by posting questions or just reading. Or we have a video library of educational programs that we don't record any of our participatory programs like support calls, but we do the more webinar style educational programs. So whatever makes you comfortable and fits where you are right now is where we want to be able to meet you. And so absolutely, I think you should sign up for Sepsis Alliance Connect, whatever you're feeling ready for or looking for right now.
Thank you, Megan. We have another question. I like this one. So whoever can take it, but I think Tom and or Steve, if you could correct one misconception about sepsis, what would it be?
Wow. How much time do we have? Steve, why don't you hit first?
Oh, I was going to say, I want to hear what you have to say because I have sort of I have more than one, so I apologize for that. But on the provider side, the misconception that still exists is that you have to be critically ill to have sepsis. Um, it is 100% true that sepsis likely does lead to critical illness if it's not dealt with appropriately and early. Um, but you don't have to be in shock to have sepsis. And yet many, many, many providers still look at it that way. Um, on on the public awareness side, I want to get rid of the term blood poisoning. There is no such thing as actual well, yeah, it is. Sepsis is poisoning of the blood. There's no question, but we just need to drive that out of our lexicon, and doctors need to quit saying it to patients. Um, and patients need to understand that it's not just poisoning of the blood, it's your body's response to the poisoning of the blood, and it is sepsis, not blood poisoning. Those are two of the things that I would like to change.
Those are good. I would say I still see in newspaper articles, news articles, um, sepsis a rare condition. The other is that a lot of people think that's you only get that if you're old and very sick and in the hospital already. So these are things that are clearly not true that we are working hard to dispel.
Yeah. I'm going to add one more thing that we just have to get rid of. Doctors think, and probably patients, a lot of patients think who haven't experienced this, that sepsis is something you live or die and you're done when you get out of the hospital.
That's a good one.
And sepsis leads to lifelong impairments for many, many people. And we need to understand that it's not just an acute illness, it's a chronic illness.
Thank you. Anyone else want to comment on that? Carl, I see your mouth moving, but you're muted.
Okay. Just one factoid I read the other day, which kind of shocked me. It was 76% of the population has a chronic disease, and all those with chronic disease raise their chance of sepsis. So you think, well, it won't happen to me. Well, it has happened to me, so I've had it. But I was shocked. It was so that's 195,000 people and a million people in the United States who have one or at least one chronic disease. So it's a real issue. We all got them, and there was a number, something like 30% of people up to the age of 35. I thought that many people got at 35, under 35. So we're all at risk.
Yeah, I think that's right. We're all at risk is a tagline. Carl, you're right.
Yeah.
We're all at risk. This does not discriminate.
Yeah. Thank you. Before the next question, Hannah, someone in the chat would like the slide with the QR code on it, the Giving Tuesday slide, I believe. Thank you. All right. As an organization, what is your biggest challenge and your biggest win?
Wow. I think, when I met Carl, I had not heard of sepsis. And I think, the mountain we're climbing is to make sure everyone knows what it is. So I think that's both a challenge and a huge accomplishment for us that when I met Carl and heard the story, the CDC was not working on sepsis, remarkably, in 2002. They just did. Not it wasn't in there anywhere in their workflow. And remarkably, Microsoft, the company, did not have the word in its dictionary. So it was a spell check error if you typed the word sepsis in. So there were no conferences. There were no, there was critical care work being done on it, but, that very, very limited work being done on sepsis. And we've come a long way. We still have a long way to go, but we're really doing important work and making a lot of progress, and we can build from here.
Yeah, I got a call yesterday. Actually, it was a text thanking me for what I had done, started this. And it was a lady who was a quad. She had lost all four limbs, and she just thanked me that she was alive. Now, when I retired, I had done 33,000 root canals, and I thought that was something pretty special. But to get that letter for the lady to thank me that she's just alive was more important than 33,000 root canals. So doctors have the advantage of saving people's lives. It's a difficult job, but my gosh, to save one life is incredible. That's some legacy.
Tom, I want to bring up one other thing that I think is a huge challenge for us right now. And that is, in spite of everything you've heard, there is a large faction of people out there, physicians out there, who believe that we overemphasize sepsis as a diagnosis, who believe that we should not have regulations such as CMS's SEP1 regulations that force hospitals to report on what they're doing about sepsis, that we give too many antibiotics to people with suspected sepsis, and who are essentially attempting to undo much of the work that Sepsis Alliance and other people have been involved in getting into place. Those people sadly have the attention of the CDC. They have the attention of CMS. And one of our biggest challenges, I think, in front of us is making sure that we maintain a national posture of being aggressive, diagnosing early, treating aggressively and early, and not looking back. And I think to me, that's the thing that gives me nightmares, that there are literally people out there thinking, oh, you folks just put too much emphasis on sepsis. It's a
Yeah.
big challenge. And I think everyone that you can tell about that needs to understand it, needs to hear it, and needs to know to talk to the people they can talk to, your congressmen, your state legislators, your senators, and let them know that this is not something you're willing to stand by for.
The other thing that worries us is the diminishing vaccination rates in the country as more anti-vax or vax hesitancy communication gets promulgated. And you saw earlier Megan's materials about Get Vaxxed, which is our attempt to restore vaccine confidence. And the best way to not get sepsis is to not get an infection. One of the best ways to not get an infection is to be vaccinated. So that's a very, very big part of our education. So we don't want to see you in the ICU. We don't even want to see you in the emergency department. We don't want to see you at all. So, vaccinations are really, really critical component of that. And we have lots of, information and videos. We have a wonderful animated video that was done featuring our character Bug for kids in English and Spanish about, wash your hands. If you get a cut, tell a grown up. These are basic things that we just don't do universally, and they're critically important.
All right, we've got a couple more questions here. I'm going to put a link in the chat for post-sepsis syndrome, but someone was wondering so they had been denied disability and wondering if sepsis is now recognized as a serious illness. And can you speak more on post-sepsis syndrome and how that possibly affects some of us long term?
Doctor.
Yeah, I thought you might want me to take that. Well, first, in point of fact, our resident expert on one form of post-sepsis syndrome is Katie, and that is a very obvious. It's easy to anyone to look and see that someone lost their limbs, or their fingers, or their toes, or their nose. People lose their noses. That's an easy one to see. What people don't recognize as well is is that many people who have an episode of sepsis suffer long-term cognitive dysfunction. And the studies will show that even years later that they are unable to do things that are simple, draw pictures. The doctor will say, draw a picture of a watch or a clock face here, and people struggle with that. People struggle with mobility issues, um, and many people who've had sepsis lose the ability um, to do activities of daily living. And you wonder, what does that mean? Activities of daily living. Some of the items listed include brushing your teeth, uh, putting on your clothes, uh, getting into bed, not even getting out of bed, but getting into bed. So simple things like this, people lose the ability to do, and many it's long-term and lifelong. Um, that's what post-sepsis syndrome is. We're fortunate that there is now at least an ICD-9 code that can be used, or it's not 9, I'm sorry. It's now ICD-10, an ICD-10 code that can be used by doctors to signify that this person has had sepsis and is suffering from the long-term consequences. What we don't have yet that we need is that insurers have not necessarily said that they recognize that ICD-10, that it means that they understand this means there should be longer visits with the doctor. There should be closer and better follow-up. And we are fighting that fight as well, because that's where we need to get. We need doctors to understand it. We need insurers to understand it. And in point of fact, we need Medicare to understand that better than they do.
Katie, do you want to weigh in?
Yeah, I mean, the biggest thing I would say is that anything that's new to you after you had sepsis and after you went through that doesn't go away is part of post-sepsis syndrome. I mean,
Good
and if
words,
you,
Katie.
I mean, it's
Yeah.
just there's so many things, and I mean, I personally had post-traumatic stress, and that I had treated by a psychologist using a technique called EMDR that really helped me with that, because I was having trauma going through the hospital in my wheelchair, trying to get to my appointments with my physical and occupational therapist, and I was passing the room where I had had my legs removed. And both my husband and I were having severe stress reactions, and we both went through treatment, and it was helpful. And and whether or not, I mean, it is important to have the code so that things are covered by insurance. But I mean, there's mental things. I went through depression for years. And I feel at this point now, after 6 years, I'm finally off of my antidepressants, and I'm feeling like I can float myself now, a lot thanks to all the work I get to do with Sepsis Alliance. But there are so many emotional and physical, and a lot of people who didn't lose limbs and are so grateful that they didn't lose limbs, they have severe pain and suffering. They had extreme nerve damage in their extremities. And I meet a lot of people who live life, and they say, gosh, there's a part of me that sort of wonders if maybe it would have been better to go the way you went. And for me, there was no saving my limbs. They had died. But for some people, when they are saved, it's also very painful. And so it's just, and it can easily be overlooked. And so it's important. I just want to go back to the community thing, and just, it's important to be a part of the community. Please join the sepsis community and get involved, and just understand. You start talking to other people, and you realize that all this stuff's happening to you. You are not crazy. It's real, and it's starting to be recognized thanks to the work of Sepsis Alliance. So appreciate that.
One more word to tie some things together too is Hallie Prescott and the Michigan Consortium of Hospitals Working on Sepsis actually have data that indicate that early recognition of sepsis and rapid aggressive treatment of sepsis can prevent post-sepsis syndrome. And that's all the more reason for us to have such things as SEP1. It just all ties together.
Yeah.
Thank you. Well, we're at time. Thank you everyone for joining us. Follow us on social media at Sepsis Alliance if you don't already. And we will send an email with the recording so you can share it with anyone who may have missed it. Thank you to our board, our staff, our whole team here for presenting today. And I hope everyone has a wonderful rest of your Giving Tuesday.
Happy
Thank
New
you,
Year,
everybody.
everybody.
Bye-bye.
Thank you.
Thank you for everything, Savannah.